Hello dear viewers, in today's video we'll be exploring a very important topic in both eye health and genetics: cataracts in infants and children. Cataract isn't just an eye condition, it can also signal genetic syndromes, metabolic disorders, or environmental exposures. So today, let's break it all down together, step by step, using a simple mind map. A cataract means the lens of the eye becomes cloudy. It loses its normal clarity. It can be seen right at birth or develop in early infancy. Congenital cataracts occur in about 1 to 15 out of every 10,000 births. If both eyes are affected, the chance of a genetic cause goes up to 22 to 27%. While cataracts are common with aging, congenital types often point to deeper problems like syndromes, metabolic diseases, or structural issues in the eye. So how do we approach this in the clinic? The first step is always a detailed clinical evaluation. We start with a full family history, including a 3-generation family tree. We ask if the parents are related by blood and when the cataract was first noticed. Was it in one eye or both? Did the mother have infections during pregnancy? Was there any medication exposure? If the cataract comes along with hearing loss, light sensitivity, or developmental delays, then we start thinking about a syndromic condition. In the physical exam, we check more than just the lens. We look at the whole eye and the rest of the body. Growth problems, small head size, or short stature could be important signs. We examine the face for features like deep-set eyes or a beaked nose. The mouth and teeth are also checked. Things like cleft palate or unusual tooth shapes can help point to a diagnosis. The skin might show blistering, dryness, or light sensitivity. We also examine the arms and legs for asymmetry or tight joints. If there are no other symptoms, we call it an isolated case. We begin with some basic lab tests. These include a torch screen to check for infections from the womb, and urine tests to look for reducing substances and organic acids. Blood and urine may also be tested for protein, calcium, phosphate, and amino acids. If there's a family history, we also examine the parents' eyes. But if we think the cataract is part of a syndromic or metabolic condition, then we do more advanced testing. For example, we measure VLCFA in the blood to check for peroxisomal disorders like Zellweger syndrome. For CTX, a cholesterol metabolism disorder, we test sterol and cholesterol levels. If we suspect bone problems, we do a skeletal survey. If DNA repair disorders are suspected, a skin biopsy may be needed. If there's hearing loss, we do audiology tests, especially if we suspect Cockayne syndrome or NF2. And finally, we can perform genomic testing, like gene panels, microarrays, or whole exome sequencing. So, what conditions are linked with congenital cataracts? Here are some of the main ones: genetic syndromes, trisomy 21 or Down syndrome, Cockayne syndrome, Stickler syndrome, Nist syndrome, Nance-Horan syndrome, Hallermann-Streiff syndrome, Wiedemann-Rautenstrauch syndrome. Metabolic causes: CTX, cerebrotendinous xanthomatosis, CDP, chondrodysplasia punctata, Lowe syndrome, galactosemia, peroxisomal disorders. Each of these conditions may cause not only lens opacities but also many other symptoms. Cataracts must be diagnosed early. If not treated, they can lead to permanent vision loss. This is why a multidisciplinary team is key. You need an ophthalmologist, a pediatric geneticist, a metabolic specialist, a neurologist, and sometimes a physiotherapist too. Developmental therapy, special education, and family support are all part of care. Cataracts might be just a clue, a signal of something much deeper. That's why timing, symptoms, and genetic background must all be considered. Let's keep going and talk about timing more specifically. Cataracts in newborns and infants are often caused by inherited metabolic or syndromic diseases. Galactosemia is one of the most common. It's autosomal recessive and caused by GALT enzyme deficiency. These babies may have jaundice, feeding issues, and poor growth. Galactokinase deficiency is also autosomal recessive but improves with diet. Lowe syndrome is X-linked and caused by OCRL gene mutations. These children may also have kidney issues and developmental delays. Peroxisomal disorders like Zellweger syndrome or rhizomelic chondrodysplasia punctata often have a poor outlook. COFF syndrome can cause progressive brain degeneration. Hallermann-Streiff syndrome includes small eyes, a tiny jaw, and sparse hair. Wiedemann-Rautenstrauch syndrome, or WRS, looks like early aging and includes lipodystrophy and visible veins. Nance-Horan syndrome is X-linked and includes cataracts, dental issues, and intellectual disability. Cataracts that show up in early childhood also require attention. Stickler syndrome is a common cause. It comes with myopia, cleft palate, hearing loss, and joint pain. CDP comes with skeletal findings. CTX is caused by CYP27A1 gene mutations and is treatable. It causes neurologic problems and cataracts. DNA repair disorders, like Cockayne syndrome and progeria, appear in childhood with early aging and light sensitivity. In teenagers or adults, juvenile cataracts may be linked to NF2, especially when schwannomas are present. In adults, myotonic dystrophy is a classic example. It comes with muscle weakness, heart rhythm issues, and other systemic features. Genetic counseling is very important. Even when the cataract seems isolated, recurrence risk may be related to mutations in crystalline or structural proteins. Most isolated cases follow an autosomal dominant pattern, but recessive and X-linked forms also exist. Carrier testing can involve slit lamp exams, DNA testing, and examining relatives. And if a mutation is found, prenatal diagnosis is possible in future pregnancies. To summarize, the age of onset, associated symptoms, and genetic findings all give us clues. When cataracts appear early or affect both eyes, we must always consider a full systemic evaluation. And again, a multidisciplinary team is the best way to approach care. In this video, we've covered cataracts from A to Z: definition, causes, syndromes, diagnostics, and management. If you found this helpful and want more medical content, don't forget to like the video, subscribe to our channel, and drop your questions in the comments. Thanks for watching, and stay healthy.